what should countries do in view of this new threat?
Countries must enhance surveillance and sequencing efforts to better understand circulating SARS-CoV-2 variants. They should submit genome sequences and associated metadata to a publicly available database such as GSAID. Countries must report initial cases, clusters associated with Omicron to WHO. Where capacity exists, perform field investigations and laboratory assessments to improve understanding of the potential impact of the variant on epidemiology, severity, immune responses, and other relevant characteristics. As part of enhanced surveillance, countries need to ensure they have early warning systems in place composed of multiple indicators such as rapid increase in cases and test positivity rates. It is also important to monitor indicators related to pressure on healthcare systems such as bed occupancy in wards and intensive care units. Event-based surveillance must be enhanced, such as rapid spread of outbreaks in healthcare facilities or communities, which may be triggered by a variant that spreads more easily from person to person, or increase in cases among populations expected to have a high level of immunity with prior infections or high vaccination coverage, which may indicate the presence of a variant able to evade the immune response. Comprehensive, tailored, and timely public health and social measures to curtail transmission must continue. The earlier the protective measures are implemented, the less restrictive they would need to be in order to be effective. All efforts should continue to scale up vaccination coverage. Preliminary evidence on Omicron suggests higher transmissibility. Regardless of change in severity, increase in cases alone may pose overwhelming demand on healthcare systems and may lead to increased morbidity and mortality.
And one of the questions everyone has is, do the current vaccines work against the new variants of concern?
Even as studies are ongoing to understand effectiveness of vaccines and therapeutics in view of the multiple mutations in Omicron, it is reasonable to assume that currently available vaccines offer protection against severe disease and death. Efforts should be intensified to accelerate COVID-19 vaccination coverage in all eligible populations, but with priority for populations at high risk of serious disease who remain unvaccinated or not yet fully vaccinated. These include older adults, healthcare workers, and those with underlying conditions which puts them at risk of severe disease and death.
And Dr. Khetrapal, why are we hearing of many cases among vaccinated people?
First, it is important to note that although vaccines can reduce your chance of being infected, they do not completely prevent it. And this holds true for all vaccines. So it is possible for a vaccinated person to get infected. This is true for all variants. For Omicron, we have been testing more in certain populations that have higher rates of vaccination, like international travelers. If we test more vaccinated people will test positive. Studies are ongoing to see if Omicron has an impact on vaccine effectiveness, and it is important that we are patient. It will take 2-3 weeks before we have clear evidence of the vaccine's performance against Omicron.
So, Dr. Khetrapal, as Omicron is spreading, it's being found in more and more countries. What is the World Health Organization's advice on boosters?
As of 11th October, SAGE recommended that moderately and severely immunocompromised persons should be offered an additional dose of COVID-19 as part of an extended primary series, since these individuals are less likely to respond adequately to vaccination following a standard primary vaccine series and are more likely to develop severe COVID-19 disease. To make a recommendation on the use of booster doses for the general population, more data is needed on vaccine performance of the primary series over time. This will help decide if and when booster doses may be beneficial, along with safety and dosage of booster doses. All of these aspects may vary by vaccine products and by disease risk groups. The benefits from boosting versus the benefits from expanding the coverage of primary vaccination in different population groups are being currently reviewed. The effectiveness of vaccines against severe disease among vulnerable population groups such as older adults and the potential benefits of boosters in these groups are under review. The booster policy has to be considered in the context of the goal of preventing severe disease and death and protecting the health system. WHO recommendations will be updated as more evidence becomes available.